Hi, my name is Jesus Gonzalez,
My name is Michael Ortega.
and this is our documentary film called A Life-Changing Story. Second part about our film is about me, living the life with a double-line transplant and cystic fibrosis. Hope you enjoy it.
I'm Jennifer Lance Burns, and I'm Jesus' 5th grade teacher. And I always am amazed at Jesus's determination in whatever he does in his life. I have a story about Jesus that when he was in the 5th grade and he would cough, and students would always ask why Jesus always coughed a lot. And he just said that, Jesus, that's just who he is. And that story that has always stuck with me. I did not understand fully what cystic fibrosis was as far as if it affected any of the learning skills. So as far as teaching Jesus, I did not teach any differently to Jesus. What made Jesus different from the other students, I think, as far as anything that was noticeable, again, was just the coughing. And I know that physical activity was, Jesus was not always able to participate in physical activity. And I remember that in 6th grade, or maybe it was then in the 7th grade, he was able to participate and be on the soccer team or the after-school sports. And I know how proud his father was. I do remember seeing his father at the games that I attended at the Y, and so I know that was special that he was able to participate in that. And it was a pleasure to have Jesus in my class, and a student that I will always remember.
Hola, mi nombre es José González. Soy el padre de Jesús González. Mi hijo tiene una enfermedad llamada cystic fibrosis, la cual fue diagnosticado cuando tenía 6 meses de edad en Lucile Packard Children's Hospital en Stanford. Él ha pasado por muchísimas cosas, pero nunca ha parado de luchar. Siempre ha tenido una actitud positiva al hacer todos sus tratamientos y tomar todos sus medicamentos. Desafortunadamente, sus pulmones funcionaban cada vez menos. Fue en ese momento cuando el doctor dijo que el trasplante de pulmones era su mejor opción para mejorar su nivel de vida, y tomamos la decisión que era lo mejor para él. Hasta este momento, él tiene una vida llena de actividades y sigue tomando ventaja de su nueva vida.
My name is Mark Allen. I was Jesus' 3rd grade teacher and 6th grade teacher. And for a short time, I was his homeschool supervising teacher when he was in the hospital. Jesus was and is an amazing kid. There weren't any difficulties other than the small details. I did understand the disability. I looked it up online, did a lot of research on my own, talked to people, found out as much as I could. It was hard because there were times that Jesus had more hope for the future than I did. I didn't treat him any differently, as best I could. The thing that made him different was the amazing drive. He always kept a positive attitude.
I'm Carol Conrad. I am an associate professor of pediatric pulmonary medicine at the Lucile Packard Children's Hospital at Stanford. Cystic fibrosis is an inherited disease that causes a defect in a protein that normally moves salt into and out of sweat ducts and your lungs and your intestines, and helps people to keep secretions nice and thin and keep away infection. So the things that are very beneficial to patients who have cystic fibrosis are to maintain their lungs clear of mucus. And we have patients take medications, breathe in medications to help loosen secretions, and we teach them how to do chest physiotherapy to help them cough out their secretions. And we also concentrate on nutritional status, so that the better the nutrition is, the better the lung function tends to be. If, as patients grow older, their lungs tend to develop more and more scar, and as scar develops, then oxygen is not exchanged very readily, and the infection in the lungs tends to worsen, and so they can develop respiratory failure. At some point, we can help people with hospitalizations and IV antibiotics to improve stuff. But at some point, if the scar advances too much, then patients are considered for a lung transplantation. We have you come in and be evaluated for other organ dysfunction and CF, since it can involve other organs, and we make sure that you understand how important it is to continue the medication regimen and go through the medical procedures that it takes to get through a lung transplant successfully. I think patients' lives change quite remarkably. You now are able to do anything you want. Exercise-wise, you're back to attending school full-time and living a much more normal life.
So me as a child, I went through many things, but that didn't stop me from being active and around with my social life. I would never let something simple knock me down and put me down. I always had in my head that good things will come in positive when you try your hardest on whatever it is. The one thing that helped me a lot was the people around me. All my family members, my friends, they all helped me out. There was a point in life I didn't have to go back to the hospital for 6 years. But then at one point my health system dropped from 70% down to 30%. And that's when I was told that I would have to wear oxygen 24/7. And I didn't know what I was going to do at that time, because I was afraid that kids at school would make fun of me and they wouldn't accept me for how I was anymore. But I came back and everything was the same. But as time went by, the doctor told me I would have to be on the transplant list. I did all the studies, I did all the expeditions, I got on the list. It only took me a month and a half to receive the call that I have my new lungs waiting for me at the hospital, and the whole surgery only lasted 12 hours. A week later, I came out of the transplant. I had a brain aneurysm, which is a brain bleed in your head. So I had to go in for an emergency surgery. After all this, first the transplant, then the brain bleed, everything, I was in the ICU for a whole month, in intensive care unit. After a whole month in the ICU, I went to a place called Ronald McDonald House, which was basically home for me for a whole 2 months. Every day now, I'm up to my medications and I'm never failing any treatment or pills, anything. I am living the new life now and I am enjoying every single part of it.
I've seen you become a involved young man. You've really taken advantage of the gift that you received from your donor, and have really paid your donor quite a bit of honor with what you're doing with your new lungs and your new life.